On December 26, 2025, a major legal and social conflict is unfolding across the United States over care for transgender youth. This issue has become one of the most contentious and emotionally charged debates in recent American history, drawing attention from lawmakers, medical professionals, families, and activists on all sides. This debate isn't just political, it's deeply personal, affecting the daily lives of families, the policies of schools, and the practices of hospitals nationwide. For many, it's about the well-being and future of their children, and the choices they must make in a rapidly changing landscape. At its core, the question is both simple and profound. Should medical treatments that help minors transition, such as hormone therapy or puberty blockers, be considered safe and necessary, or do they pose unacceptable risks to young people's health and development? The answer is far from straightforward, and experts remain divided. The issue has sharply divided federal policy and nearly 24 states, escalating this week as 19 states and D.C. filed a lawsuit against the U.S. Department of Health and Human Services. The legal battle is not just about policy, but about the rights of states, the authority of the federal government, and the future of healthcare for transgender youth. The lawsuit challenges the Trump administration's recent move to restrict access to gender transition care for those under 18, arguing that such restrictions violate civil rights and put vulnerable youth at risk. The administration, meanwhile, claims it is acting to protect children from unproven and potentially harmful treatments. For families and young people, the outcome could be life-altering. The uncertainty and fear surrounding these decisions weigh heavily on parents and their children, who are often caught between conflicting advice from doctors, politicians, and advocacy groups. Supporters see these treatments as essential and even life-saving. They argue that access to gender-affirming care can reduce depression, anxiety, and suicide risk among transgender youth, and that denying care is a violation of basic human rights. Opponents, however, worry about irreversibility and long-term consequences. They raise concerns about the adequacy of research, the possibility of regret, and the role of parents and doctors in making such significant decisions for minors. Understanding this conflict means examining the medical, legal, and ethical arguments now headed for the nation's courts. As the debate intensifies, the decisions made in the coming months will shape not only the law but the lives of countless young people and their families across America. To understand the legal battle, we need to clarify what gender-affirming care for minors means. It includes medical interventions for young people with gender dysphoria, distress from a mismatch between gender identity and assigned sex at birth. Treatments often start with reversible puberty blockers, giving families time to consider next steps. Older teens may access hormone therapy, which brings more permanent changes. Surgeries for minors are rare and typically limited to specific cases. Medical care is paired with counseling and social support. Major medical organizations endorse this model as evidence-based and necessary for many transgender youth. But the federal government now questions the long-term safety and effectiveness of these treatments, fueling the current conflict. The lawsuit was triggered by a dramatic shift in federal policy, sending shockwaves through the medical and legal communities across the country. This shift began with a new declaration from the U.S. Department of Health and Human Services, a powerful agency that oversees much of the nation's healthcare policy and funding. Under the leadership of Secretary Robert F. Kennedy Jr., HHS now officially classifies puberty blockers, hormone therapy, and gender-affirming surgeries as unsafe and ineffective for minors. A significant departure from previous federal guidance. The declaration goes further, threatening to withhold crucial federal funding, such as Medicare and Medicaid reimbursements, from healthcare providers who continue to offer these treatments to young people. This sweeping move is grounded in a recent HHS-commissioned report, which not only questions the scientific evidence supporting these interventions, but also highlights gaps in long-term research and data. The report raises serious ethical concerns, particularly about whether minors possess the maturity and understanding needed to give informed consent for life-altering medical procedures. Notably, the declaration was issued without the usual public comment period, bypassing a process designed to ensure transparency and public input, a move that has become a central argument in the state's legal challenge. So states now argue that the federal administration is imposing sweeping new health policies without following proper administrative procedures or consulting the broader medical community for consensus. The result is a direct and escalating clash between federal authority and state control over healthcare policy, with both sides claiming to act in the best interests of young patients. As the legal battle unfolds, the medical community and state governments are mobilizing to defend their standards of care, setting the stage for a high-stakes confrontation that could reshape healthcare for minors nationwide. In response, 19 states and D.C. filed a lawsuit in federal court, led by New York Attorney General Letitia James. The suit argues the HHS declaration is factually wrong and legally invalid, overstepping federal authority and interfering with doctor-patient relationships. States say the declaration spreads misinformation, contradicts medical consensus, and cherry-picks data. They also challenge the legality of bypassing the Administrative Procedure Act, which requires public input on new rules. The lawsuit seeks to block the declaration and prevent penalties against providers. States warn that, if enforced, the policy would harm families, disrupt care, and worsen mental health for transgender youth. The legal fight is about more than process. It's about protecting access to what these states see as essential healthcare. The outcome could reshape the landscape for transgender youth nationwide. The Trump administration defends its stance as a necessary safeguard for children. Officials argue the medical community has moved too quickly, without enough long-term evidence. They cite stories of detransitioners and question whether minors can truly consent to treatments with permanent effects, like infertility. The administration calls for more research and greater emphasis on psychotherapy, suggesting many cases of gender dysphoria may resolve over time. They also point to social factors, like peer influence, as reasons for caution. The new policy is framed as a course correction in a field they believe has outpaced the science. The debate is now about how much caution is warranted, and who gets to decide. The states suing HHS argue for medical autonomy and established standards of care. They say decisions should be made by families and doctors, not federal officials. Major medical groups support gender-affirming care as safe, effective, and often necessary to reduce distress and suicide risk. The states accuse HHS of ignoring evidence and promoting a politically driven narrative. They argue that denying care causes direct harm and lasting trauma to transgender youth. The lawsuit claims the policy discriminates against transgender people, violating constitutional protections. For these states, the fight is about defending the right to appropriate healthcare without government interference. This lawsuit is the latest chapter in a years-long battle over gender-affirming care at the state level. Over half of U.S. states, mostly Republican-led, have passed laws banning or restricting transition treatments for minors. These laws often prohibit puberty blockers and hormones, with penalties for doctors who provide them. In contrast, states suing the federal government have enacted laws to protect and expand access, even shielding their doctors from out-of-state legal action. The result is a patchwork. Access to care depends on where a family lives. Some families move or travel long distances for care. Others lose access entirely. The new federal declaration adds another layer of complexity, making the legal landscape even more challenging. Families, doctors, and hospitals now face a maze of conflicting rules and risks. The Supreme Court's recent decision not to block Tennessee's ban on gender-affirming care for minors sent shockwaves through the legal and medical communities. By declining to intervene, the court signaled a willingness to let states take the lead on this deeply divisive issue, showing deference to state authority even when fundamental rights and access to healthcare are at stake. This move was widely interpreted as a green light for states to pursue their own policies, regardless of the controversy or the impact on vulnerable youth. In the wake of the court's decision, state legislatures across the country have felt emboldened to pass a wave of new restrictions. Lawmakers in several states have introduced or advanced bills that further limit or outright ban gender-affirming care for minors, making it increasingly difficult for families to challenge these bans in court. The legal landscape has shifted, and advocates warn that the path to overturning such laws has become steeper and more uncertain. For states that support access to gender-affirming care, the focus has shifted. Now, Their efforts are aimed at blocking federal restrictions that could override their own protections. State officials and advocates are preparing for a new front in the battle, one that pits state laws against federal authority and could determine the future of care for thousands of young people. Meanwhile, the Department of Health and Human Services has proposed two sweeping new federal rules that could dramatically reshape access to care nationwide. The first proposed rule would cut off federal funding to hospitals and clinics that provide gender-affirming care to minors, threatening the financial stability of many healthcare providers and potentially forcing some to close their doors or stop offering these services altogether. The second rule would block Medicaid coverage for gender-affirming treatments for minors, putting these medically necessary services out of reach for many low-income families who rely on public insurance. Although these rules must go through a public comment period before they can take effect, their introduction signals a determined federal push to restrict access to care. The public comment process offers a chance for advocates, families, and medical professionals to voice their concerns, but the outcome remains uncertain. The combination of state bans, looming federal threats, and the Supreme Court's signals has created a climate of fear and confusion for families and providers. Many are left wondering where they can turn for help, and whether the care their children need will remain available. The current lawsuit challenging these federal rules is a direct attempt to halt a key part of this new federal strategy. The outcome of this case could set a precedent for how far the government can go in restricting access to gender-affirming care. As legal battles intensify and the stakes for access to care reach unprecedented heights, families, providers, and advocates are bracing for a long and uncertain fight ahead. The lawsuit marks a turning point in the national debate over gender-affirming care for youth. The outcome will shape whether this care is guided by medical professionals or regulated by government policy. As the case moves through the courts, uncertainty looms for families and providers. Doctors in supportive states now risk losing federal funding, while families face anxiety over continued access to care. The debate raises fundamental questions. Who decides a child's medical care? What role should science and medical consensus play in policy? As of December 26, 2025, the story is still unfolding, with the future of transgender youth's healthcare hanging in the balance. For those at the center, the stakes are nothing less than their health, identity, and future.